Working in IVF from the psychological aspects of what the woman and the man and the couple ideally go through is what I'm going to be speaking here today at Genesis 2017.
Ma'am, how to balance professional and lifestyle, profession and lifestyle?
Well, it depends on the entire outlook that the person has towards what he wants from his life. I mean, I'm very clear. I think the goal of my life, at least, is to enjoy myself as much as possible. So, if my goal is to enjoy myself as much as possible, work forms only one facet of that enjoyment. Okay, and then there are other aspects to enjoy in terms of family, my interests, my hobbies. So, a large part depends on the attitude the person brings with him to the world, how he grows up, what he thinks, whether he reviews what he thinks, and I think that is essential. So, work-life balance is actually nothing but the ideology that a person has about how he or she wants to live his life.
Perfect. Ma'am, can you give us some tips to distress?
So, distress is a result of, again, faulty thinking. At the end of the day, nobody is born with distress. We learn certain faulty ideologies of how to live. So, if today as a parent I keep pressurizing my child that he has to succeed, and success to me means only getting 95%, but naturally I will be creating anxiety in the child. If I constantly compare the child to another and say, oh, how come your friend achieved this and you didn't achieve it, my child will constantly feel depressed. If I constantly keep blaming my child, you didn't study hard enough, that's why you didn't get into this medical school, etc., I will be evoking lots of guilt. Okay, and of course, if I keep blaming him and calling him all kinds of names because he hasn't met what my expectations are of him, I will make him very angry towards me. Correct. So the four common distressing emotions are anger, anxiety, depression and guilt. Correct. And they're all created by attitude. Now thankfully we are not born with attitudes, we learn it. So in a household which inculcates, unfortunately, unsensible attitudes, you will find the people getting distressed more and more as they evolve through and go through the process of living. But if you have a milieu and a family and a social culture which inculcates that everything at the end of the day is really subjective.
Correct.
So, how you view life, what you want from it, what you want from yourself, what you want from your relations, if we are able to realign and reconstruct and recalibrate that kind of thinking, distress will fall, and on the contrary, people will begin to enjoy and fulfill their lives. So, distress is nothing but faulty attitudes.
Alright. Ma'am, how to maintain a patient-doctor emotional connect so that it does not escalate stress?
So, the first thing the doctor has to do is accept that he is a human being too. Unfortunately, doctors, and I would say more from my country since I do all my work here, think that they are gods. And because you have such an outlook towards yourself, you find it extremely dismissive and kind of disdainful to kind of engage with the patient on an emotional level. So I think the first thing the doctor has to do is, first of all, step back and look at himself as a human being. Step back and ask himself what are the emotions he feels when he does not, say for example, succeed at the IVF that he is doing. Okay, a lot of doctors blame their patients. They feel that the patients are not listening to them. They feel that the patients are not cooperating with the treatment, that the patients are not following protocol. And then that directly affects the doctor's numbers of success. Now, if your entire outlook to life is my success is determined by my numbers, it is but natural that you will not be able to connect empathetically with your client, with your patient.
Correct.
Okay, so first I think is we need to accept emotionality as a part of our being as caregivers.
Correct.
As a therapist, when I sit in my office, I must be completely aware of what is the baggage of emotions I am carrying when I'm going to be seeing my patient. Am I disturbed by something at home? Is there something I don't like about the patient? My own biases and prejudices about certain conditions, okay? It will automatically affect the way I try and deal with my client. So I think acceptance of self emotions, that means becoming self-aware, okay, not being judgmental about sometimes an anxiety provoked patient, sometimes a guilt provoked patient, sometimes a depressed patient, but for that I think we have to treat the human being as a whole and not separate IVF's treatment only as a form of treatment and then discount the human being. And so I think that is essential. So I will be able to only develop patience and tolerance first if I have patience and tolerance with myself.
Correct. Ma'am, I'm sorry to
Sure.
interrupt you.
No.
You could finish.
No, that's
but
fine.
Yeah. Ma'am, you've met a lot of IVF specialists, okay, in this conference. So, and I'm sure you must have heard a lot of questions. They must have asked you a lot of questions about dealing with patients. So, what are your take-home messages for these doctors?
I think the take-home messages for these doctors is, first of all, do not segregate the treatment. You're at the end of the day treating a human being.
Correct.
Do not discount emotion. Emotion is an extremely important part of being human. Recognize the emotional upsetness that your patients do go through. Do realize that your patients are not living in box holes, okay, where they are living as entities in their own right. They are living in a social world. Their ecosystem is being governed by social messages they are receiving. They are receiving messages that they are incomplete as women if they are not able to procreate. They are receiving messages that they are, you know, the selfish double income, no kids kind of couple who don't want children. They are receiving messages that they failed in a very important facet of life. They are receiving messages that they are failures.
Correct.
So if you can understand the psychological world of your client, automatically your dealing with the client will change. Your emotional connect with the client will change. And trust me, my patients know whether I'm connected to them or not, or whether, unfortunately, I'm just trying to make money.
Perfect. Ma'am, we'll take a break here,
Sure.
and then I have to ask you another set of questions.
Sure.
Now this is about battling the self-blame of infertility.
Yep.
Okay. Again, we're recording again. How can a patient overcome the self-blame game?
I think the patient, and that's what I do in my IVF treatments. Sorry, we are recording. Yeah. I think
Do
you'll
we
have
need to do it again?
No, I think you'll have to edit, right? Yeah, edit.
Yeah. He will edit. Okay.
Yeah. So I think the first thing, and this is what I'm going to cover here, is that the patient needs to be empowered with one message. That everything that goes wrong in IVF is not because of her.
Correct.
I think the self-blame comes because we are not taught that scientifically there are things which are beyond our control.
Correct.
My body is not completely within my control. I have endocrine problems, I have hormonal imbalances, I have so many things which is not a creation of me at all. It is not because I have been, you know, lethargic, lazy, uncooperative, or done something damaging to my body. Unfortunately, for better or worse, that is the way life is. Now, if I accept that truth and realize that there are only partly things within my control and things which are completely out of my control, it straight away gives me a lot of calmness. So I think the underscoring thing for every clinician to teach their patients is realize that whatever we do, there is still something called factor X, which is chance, which is beyond your control, not my control.
Factor is not defined.
Is not defined. What it is, I have no idea. Two is, I think, particularly in a culture like ours, we blame a lot on karma. We blame a lot on, curses. We blame a lot on the wrath of God. Okay, I think we need to try and separate that, because this is a science. It has no real place for superstitious ideologies and philosophies to come in. So I think if we can empower the client or the patient in scientific thinking that there are only certain things within your control, okay, try and control those. So if the doctor says take medicine in a particular time and in a particular way, please do it.
Correct.
Okay. If the doctor says you cannot undertake, for example, hectic activity, and I would recommend bed rest, please do it. So cooperate with instructions. But even then, cooperation does not mean guarantee.
Correct.
So I think the underscoring aspect, yet another one, is that there are no guarantees that even if you cooperate, you will succeed. Okay. And get a perspective. Life is not only about being a mother. Life is not only about being a parent. There is much more to life. Sure, it is one facet of life and maybe an important facet to you. But understand that everything that is important may not necessarily get fulfilled in your life, and you can still live a reasonably good and happy life.
Perfect. Ma'am, how important is familial support in overcoming self-blame?
I think we need family therapy. I think it's an important aspect, and in fact I'm going to thank Intas and Accord Healthcare for having me here today, because I was quite surprised and actually quite excited, because here was a company which was actually looking at the humane aspect of this kind of treatment. The IVF is not simply about, putting embryos and, getting the people pregnant. I think there's a whole socio-psychological system at work here.
Exactly.
And if we can empower the entire family to understand the processes, to understand the trauma, to understand this, the physiological impact these unfortunate constant poking, pushing, prodding has on the woman's psyche, I think we will do the woman a big favor. And I do believe that there is a mind-body connect. The more easy and relaxed the woman is, there is a probability that because of her ease, an internal calm will also allow the procedures to succeed.
Yeah, well, a lot of times what happens is women do start IVF treatment and the first cycle probably or the second cycle fails.
Yeah.
Right? With a lot of fighting a lot of consequences, they have come to a doctor and they have, started this entire process of IVF.
Yeah.
And then again, first or second cycle, there is a failure. So I have myself encountered a lot of women who, basically feel very upset and,
Of course.
Yeah.
Of
this
course.
is upsetting undoubtedly. But then how do you, inculcate faith and positivity and a good ray of hope?
So I'll tell you, I differ a little bit here in the inculcating positivity. I think we've gone as a world, we've just been bombarding the idea of positive thinking. If I am not going to get something which I want, I am going to be disappointed. I need the person to experience disappointment. Sadness is not an unhealthy emotion. It is not positive. It is coming to terms with, yes, I have not got something which I have desired and I am going to feel sad, I am going to feel disappointed, I am going to feel dissatisfied. There is nothing positive about not getting what you want. So, throw away the stupid idea of positivity. I think it does more damage than good. The patient feels that what kind of a stupid doctor is this? He hasn't understood that one of my biggest wants in life are not being met, and he's telling me stupid jargon like be positive, stay strong, don't worry about it. It is a worry because it is a desire for me.
Yeah.
It is a concern because it is something that I am not getting fulfilled by. Okay, so we don't want positivity, we want realism. And we want the person to experience healthy emotions. So when I had a client who came to me because of 3 IVF failures, okay, in fact she's the one who I'm going to be talking about today. Okay, she came with an idea that here was a therapist who was going to try and help her stay positive. She was very surprised when I said it's okay to feel sad. That is the definition of being human.
Correct.
Being human means being emoting. I don't want to take away any emotion from you. Then there's no better than you becoming a table or a chair.
Perfect.
So sadness, disappointment, regret, concern, dissatisfaction are all emotions we want them to experience. The problem happens when they jump and make their sadness into depression. They jump and make their disappointment into devastation.
Correct.
Then we have a problem.
Correct. The last question is that how to consult. Oh, did we shift so much?
Sorry.
Oh my god, okay. I didn't even realize, okay. How to counsel the partner to form a mutual support base for couples?
For that, you need to re-educate the mind of the man. And in a country like ours, and I was on the Nirbhaya show with Times Now 2-3 months ago, I said, rapes will happen, sexual abuse will happen to the woman because the women who are bringing up their boys are bringing them up with very narrow ideology.
Correct.
So if your entire mindset of the man is that he is special and that there is nothing wrong with him, and this is where also a lot of trouble comes in IVF treatment, because more often than not they start poking and prodding the woman without even first going out and checking the sperm count of the man.
Correct.
That is there a problem in his sperm, is the motility of the sperm not good enough, etc., etc. Because it is not manly to do that.
Correct.
And if today we are not going to change attitudes and ideation of the man, that hello, this is not the woman's responsibility alone, it's a partnership. At the end of the day, parents are partners to children.
Correct.
Right? So why are we not a part of the process? And if today, maybe if the man is not a part of the process of the woman's pain, emotional and physical, we would wonder what kind of a parent he would make.
Right. All right, ma'am. Thank you so much. That was very, very insightful.
Pleasure.
Thanks.
Thanks. Thank you.